are in line with what DHEC has already been putting into motion over the last few weeks. If you recall, we announced plans to move to weekly data reporting later this month. And we recently changed our school guidance from recommending mask requirements in schools to encouraging masking as part of an individual's decision to protect themselves and their loved ones. As we move into year 3 of COVID, our state and nation recognize this transition to endemic has to be more about the daily habits and practices of individuals. That said, DHEC's goal has not changed, and neither has our commitment to South Carolinians. That's why, due to the decreased demand for in-person testing, we're transitioning away from these facilities and instead providing free at-home rapid antigen tests at our public health departments. These, along with the free tests folks can order at covidtest.gov and other options for COVID testing, will meet demand moving forward. And during times of high transmission, we have the ability to order more rapid tests for residents. Knowing your COVID-19 status if you're feeling sick or a close contact, along with masking during periods of high transmission, are important components of being in a successful situation of endemicity. And of course, we continue urging residents to complete their initial vaccine series and get boosted when eligible, because we know a higher vaccination rate is still a key tool in reducing hospitalizations and death. Unfortunately, this virus is here to stay for the foreseeable future. We can't control that, but we can control how it will impact us and our loved ones. So we strongly encourage South Carolinians to follow these important guidelines and prevent COVID from doing further damage to our state. Thank you.
Thank you, Dr. Konopka, for those remarks, and we will open it up now for live questions. But before we do, I want to remind folks that the purpose of this briefing is to inform and educate the public on the status of COVID-19 in South Carolina and answer any questions you may have about it. Any requests or questions about anything other than COVID can go directly to our media relations channel at media@dhec.sc.gov. If you have a question, please raise your virtual hand and I'll recognize you in the order in which you raised it. And out of fairness, I'll try to get to everyone who wants to ask a question first before I come back for follow-ups. Damien Dominguez, go ahead, please, sir, with your question.
Yes, thank you very much. Talking about the move towards this change in the testing strategy, can you kind of talk a little bit about the timeline and kind of where the initial like PCR testing sites that are being closed, where those are, and kind of the locations that will be affected over time here?
Sure. So over the coming couple of weeks, we're going to be looking at where there's a need for testing. If there are partners in the community where people have the option to go get tested, that means that that's not necessarily a site that DHEC has to support. But in areas or counties where there aren't testing options readily available, we plan to leave those open for some time. But we'll be planning to step these down in a reasonable fashion in the coming weeks, and more details of that will be available to the public.
Thank you for your question. Anybody else have any questions? I don't see a single hand raised. There we go. Zaria, go ahead. Welcome.
Hi, I wanted to know, what is DHEC's plan if a new variant emerges, given the reduction in testing centers?
Yeah, so right now the focus and importance of surveillance is shifting to monitoring measures of severity rather than counting each individual case that might come up, as we're moving to more of an endemic response to COVID-19. And so, we're going to be looking at deaths as an important measure of severity, as are hospitalizations, and hospitalization data is something that gives us a more quick, real-time picture of the strain on the healthcare system in our community. So we'll simultaneously continue our surveillance for new variants, doing whole genome sequencing by using the same random sampling process our lab has been using up to this point. And I think that process has proven successful in tracking variant presence across the state, and that's not going to change under our new disease surveillance and data reporting system.
Thank you for that. Matthew, go ahead with your question.
Hey there. I think one thing a lot of people in the public aren't quite understanding is that, as these kind of cases within the past month or so have been on the decline after Omicron, nationally and statewide, we're kind of shifting to this endemic response. What makes right now different than all the other times in the past 2 years that cases have really gone down and we've been in like kind of a lull with COVID? Why is now different than say last springtime when cases were fairly low?
I think the big thing is that we have vaccines now compared to a year ago, and more people have been infected compared to a year ago. So historically, these trends happen with pandemics across time, where you see different waves. And as time progresses, either the pathogen loses its strength through its mutations, and or the population has developed some sort of immunity. And millennia ago, there were no vaccines, so it would just kind of run through, and you see a lot of people dying until you reach a certain level of immunity in the community. And so I think what you're seeing now compared to the past is we have higher rates of vaccination, and people have immunity from that, or they've had the infection itself. So even though there are very high case rates this go around with Omicron, you saw as a rate the hospitalizations were less compared to rates of hospitalization in the past, and I think that's largely due to vaccinations. Does that answer your question?
It does. It does. Thank you.
Mm-hmm.
Thank you for that. Dana Lynn, go ahead.
Yeah, I was looking over the opioid deaths, the fentanyl deaths during the 2 years, give or take, of the pandemic. We all know that mental health is a very important thing, pandemic or not. Does DHEC have any current programs to help people in crisis? Where can people who are in crisis turn for help?
That's an excellent question, and we do have DHEC and Department of Mental Health that would be able to address that more specifically than I can right now. And if you Ron or somebody on our team can take note of who asked that question, we can make sure to get that to you. But certainly during the pandemic, there have been other issues going on regarding people's health. You mentioned opioid crisis, and that has continued on in the background, as have hepatitis A. Has been an issue as well. So there have been things, obviously, for the public's health that have continued, pandemic or not. And so that's something that we're mindful of. And, we have lots of folks in the DHEC agency that are working on those things as well. Obviously, it doesn't get the same attention probably as, the pandemic has, understandably, but that's something we continue to work on.
Thank you. And I just put a link in there in the chat line for some of that. There's resources that are available all done through the DHEC and other sites. Anybody else at the moment have any questions? Sorry, go back ahead, please.
I just wanted to know how confident is DHEC in the state's vaccination status of 54%. It seems to have plateaued a little bit. But if another variant were to emerge, or if severe cases seem to be piling up, how confident are you in the state's vaccination status right now?
Yeah, so I think, as I mentioned earlier, the vaccination status, we're trying to get to some level of immunity, right? And so, being vaccinated and boosted and being up to date is one of the best ways to do that. Obviously, there's been plenty of natural infection that has given some level of immunity as well. So we continue to recommend that people stay up to date on their vaccines. They get their boosted when they're due. And that's the best thing that we have right now in preventing spread right now in community. So we continue to recommend that people haven't been vaccinated, they go ahead and get vaccinated and get their booster.
Do you think we're close to herd immunity?
Yeah, that's a good. That's been a little bit of an elusive and moving target a little bit. Because we made initial projections based on earlier strains of the virus, and as variants have come along that have different mutations, we've seen that people who've previously been infected still get reinfected. People that have been vaccinated, they still get a mild form of the illness, even though they stay out of the hospital, which is our goal. So that's a little bit of a moving target, and I don't know the exact answer to that question.
Thank you.
Thank you, Zara. Jason Raven, go ahead, sir.
Hey, Dr. Kanuka. Who and how is it decided that COVID-19 is endemic, or gives it that endemic status? Is that a kind of like health organization kind of thing, or is that by state, or how does that kind of work?
Yeah, so the term endemic essentially refers to a communicable disease that is circulating in a community at expected levels or at low levels, that might have occasional outbreaks. So we have lots of diseases like that now. Probably the most common one is flu. It's something that is in our community, and then we have outbreaks and surges at certain times in our year. Whether or not, COVID is going to become like that, I don't know, or if it's going to become like other SARS viruses, novel coronaviruses like MERS and SARS in the past, we don't know that yet. But the idea essentially is when you get to endemic levels, that there's some low level baseline level of spread in the community, and that's something that is looked at by public health bodies like the CDC and health departments to kind of figure out where we are. But that's something that would happen largely on a federal level.
Thank you for your question. Eric, go ahead, sir.
Hi, I'm wondering, the CDC under their new way to determine community spread. If you look under that map, Richland County and a lot of Midlands counties are still under high level of community spread, and they're urging everyone to wear masks indoors in public, including in schools. And I know that data, I'm not sure if that data matches what DHEC's website case rate map says. Will you guys be putting that data on DHEC's website so people can see what the CDC says, or
yeah,
how would somebody know that info, and do you guys recommend people following that for their counties?
Yeah, so we agree with what the CDC is putting out about the risk and the way that they're portraying the data and their recommendations. We're in the midst of updating the way that we present our data as well. So I understand your question. So obviously there are different places around the state that have different levels. I'd say probably about half of the state is in considered a high transmission category, and the other half is either medium or low. And that data is going to be updated once a week from the CDC. So I believe that data was last posted and last updated from February 24th. So I anticipate that would get updated here in the coming days. I don't know exactly what CDC's calendar is, but they're planning to update it weekly. And
Great, thank you.
Yeah.
Thank you for your question, Eric. Does anyone else have any questions at this time? All right. Seeing none, I do want to add that a recording of today's briefing will be available later on this afternoon on our YouTube page. And we will also be going to a bi-weekly media briefing schedule for our COVID-19 briefings. We'll be off next week. We'll be back the week after that. So that'll be basically the first and third weeks of the month going forward will be our weekly media briefings. And of course, for the weeks that we're not having them, we'll take your questions as they come in all during the week. So we'll be here to be responsive to you then. Dr. Kanuka, thank you so much for your time today. Well, I'm going to let Zaria ask one more question. Go ahead, Zaria.
Yeah.
Bless you, Ron. I appreciate it. Does DHEC have a metric they are using that'll tell them when they need to open back up their testing centers?
Well, I think at this point, as I've said earlier, we're looking at moving our response to seeing that there's a rapid decline essentially in testing demand, and that there's increased availability of accurate at-home rapid tests. And we're going to make those available at our health departments. So at this point, that's our plan, is to really stick with allowing people to do their at-home tests, seek a provider in the community if they want. And if things change for some reason, we can revisit that. But at this point, our plan is to move away from that strategy and recognize that this disease will be with us for the foreseeable future, and at-home tests are accurate and they're reliable and they're readily accessible. And so we'll use that to give people information they need. So when they're feeling sick, aren't feeling well, they can go do that test and say, hey, yeah, I've got COVID. I definitely shouldn't be at work, right? I shouldn't be at school, and follow those great public health measures to make sure they're not spreading their illness around the community.
Are you guys still using wastewater management data?
Yeah, so I think not just in South Carolina, but nationwide as well, that's becoming an increasing surveillance tool, is to look at potential pathogens in wastewater and see what may be coming as a potential strain for the healthcare system and in the community.
Thank you.
Mm-hmm.
Thank you, Dr. Kanaka, for your time today, and thank you to all the media present for your valuable time and your continued coverage of COVID-19 in South Carolina. Take care, and we will see you a week from today. Thank you, Dr. Kanaka.
Thank you.